Hi everyone, welcome back to my channel. My name is Crystal, and in today's video, we're talking all about periods. What's normal, what's not, all that good stuff. If you're new to my channel, hello, thank you so much for watching. I'm a menstrual health educator, and periods are kind of like my thing. I'm really passionate about them. And that stems from having my own issues with irregular cycles and realizing that I really knew nothing about my body for the first, I don't know, 25 years of my life. And so now I educate other people in knowing more about their bodies so they can support their bodies, support their cycles, and be the best version of themselves. So in today's video, I want to talk about what is a normal period, what a normal period should look like, how you should feel, all that kind of stuff. And then I want to talk about what's not normal, because there's a lot of things we assume are normal that are totally not normal. So what's normal? So normal period is 3 to 7 days long, and it happens every 25 to 35 days. So every 25 to 35 days you should be getting your period. And so if you're getting your period within that kind of time frame, that's great. That's a super normal, regular cycle. Now, with that being said, if you are a teenager watching this, you might have irregular cycles or you might have longer cycles. So for you, it's very normal to get your period every 45 days. And so that is normal for teenagers. And so I just want to make that clear, because I know when you're first a teenager, things can kind of be a little bit funky. Periods can be really irregular. You might have really long cycles. And that's just because your body is maturing. So as you get older, your cycles should start to become more regular. Now, the other thing is, if you are perimenopausal, you'll probably start to notice that your cycles might get a little bit longer as well, or they might even get shorter. And that's because as you move further into perimenopause and then approach menopause, your periods will start to become less frequent, and your hormones are just kind of finding their new normal at that time. And so it's very normal to have a little bit of more irregular cycles at that time as you kind of shift into that new season of life. And so I just wanted to make it clear that depending on your age, there are kind of different parameters of what a normal cycle looks like. But throughout these life stages, you should have a period that is red in color, having dark blood kind of at the beginning of your period as well as the end of your period. That is kind of brown color is normal, because that's usually like oxidated blood from your last cycle. And so your body's kind of trying to like get that out. And then when you're at the end of your period, usually the blood turns darker because you're not having as much flow come out. So that's kind of normal, but you do want to have like a really nice red color. And so that's what kind of a normal period color is. Now, when it comes to how much blood flow you should be losing, you want to be losing less than 80 mils. And so that is about 6 tablespoons. So if you use a menstrual cup, it's very easy to measure how much flow you're losing. And we actually lose like a lot less than we think. And so 80 mils and under is considered like normal. Usually the average person loses about 30 to 50 mils of blood. And so you want to make sure that you don't have like a scanty light period, but you also don't want to have a super heavy period. So having it within normal range is really important, and you would know if you have a heavy period. Like a normal period is pretty easy to manage. You shouldn't be having to change your period products every couple hours. Like it should be pretty manageable. Now, when it comes to pain, no cramping or very minimal cramping is normal. It's normal to have some discomfort. It shouldn't be unmanageable pain. Pain is definitely not a normal sign of having your period. And so your period should be easy to manage, should be pretty minimal in the pain department. You shouldn't be passing any large clots or anything like that. It should be pretty easy, and even though you might feel maybe a little bit tired and a little bit run down, it shouldn't really affect your daily life too much. Now let's move on to what's not normal. So having like a super light period where it's only lasting like a day or two isn't actually normal. Even though it might sound really nice to like lose as little flow as possible, that can actually be kind of a cause of concern. And then on the flip side, you don't want to have a period that's longer than 7 days long. If you have a period that's longer than 7 days long, that's actually considered like a heavy period, no matter how much you're bleeding. And so that is, again, not normal. So if you're losing more than 80 mils of fluid, that is considered a heavy flow, and you're gonna wanna get that checked out, because a heavy flow can, deplete you of iron. It can be really exhausting and be really uncomfortable. And there's a lot of root causes as to why you might have a heavy flow. And then again, If you have a really scanty flow that's like less than maybe 20 mils or under, then you want to make sure that you are looking into that as well, because you want to be in the middle. You don't want to be on either side of the spectrum when it comes to how much flow you're losing. Now, the biggest thing that's not normal is severe pain, and I know that a lot of us experience really awful periods and really severe cramping, and that's a cause of concern right off the bat. You should not be experiencing that. Like, having a menstrual cycle and getting your period doesn't mean you just have to suffer every month. That's not right. That's not what you signed up for. No one signs up for that. And that's not what any of us deserve, and that's not normal. Like, not normal to feel like that and experience that. So if you are experiencing severe pain, you want to get that checked out, because there's something going on there. And it could be diet and lifestyle related, or it could be other complications like endometriosis and other things going on. So if you are experiencing really severe pain, you're taking a bunch of pain medication, your pain medication is barely helping you, you can't get out of bed, like your life is basically ruined for 5 days out of every cycle, please seek help. And another indication that you need to talk to a healthcare provider is if you have a period that has large, frequent clots. So what I mean by large is larger than a quarter. Like, if you're having quarter-sized clots or larger, something else is going on. You're having what's called flooding, and that is usually caused by a really heavy flow, and that is why you will experience these kind of clots. The other things that you should watch out for is if you have any like spotting or irregular bleeding outside of your period. So a little bit of spotting before your period starts and a little bit after is normal, but if you're having spotting outside of that, again, you want to kind of look into that a little bit more, because it could be due to ovulation, which is considered normal, but it could be due to other things, and it's always a little bit scary when you just spot for no reason. And there's a lot of reasons why it can happen. Now, the biggest thing that isn't normal when it comes to periods is missing your period. That's not normal, and that's not okay. You don't want to be missing your period. You want to make sure that you're having a regular cycle, because when you have a regular period, it means that you are regularly ovulating. That's how you make your hormones, and that is how you just be the healthiest version of yourself. So you want to make sure that you're having a regular period. And if you're not having a regular period, diving into why that is happening. Like, is it diet or lifestyle? Is there other conditions going on? Like, what's happening? So I hope you guys learned something in this video. I hope it taught you what is a normal period and what's not a normal period. And I just want you to know that if you're struggling with your period, it's okay to get help. Like, you deserve to get help, and it's not fair to you to have to struggle every cycle with a really painful, really awful period. That's not your birthright. Your birthright is to have normal, easy periods. Like, that's what you signed up for. And so please seek guidance if you need it. If you have any questions, please let me know in the comments. I really appreciate you watching this video. And as always, your cycle matters so much, and I'm here for you. And I'll see you guys in the next video. Bye.